why couples therapy doesn't work for people in abusive relationships. As an author who has corresponded with thousands of survivors of narcissistic partners, I have heard horror stories of those who have attended couples therapy with their abusive and narcissistic partners. The National Domestic Violence Hotline does not recommend couples counseling with their abuser, and for good reason. The power imbalance present in an abusive relationship is naturally counterproductive when entering a space where both parties are expected to participate to improve the relationship. As licensed family and marriage therapist Albert J. Dykes writes, "One error I encounter with troubling frequency is the failure of couples therapists to assess adequately for partner abuse. By partner abuse, I mean the use of force, intimidation, or manipulation, or the threat to use any of those methods to control, hurt, or frighten an intimate partner. Note that the definition can be met even if no physical violence is involved. Verbal and psychological tactics are more common. Frequently, they are also more effective at controlling, hurting, or frightening another, and they can be more emotionally damaging in the long run. I have met with couples whose seasoned therapists, over the course of several years of treatment, missed the extent and severity of the physical and emotional abuse taking place at home." There are 5 common ways couples therapy harms the victims of abuse. Whether you're a couples therapist or a survivor of abuse, I invite you to evaluate which examples resonate most with your experiences. Number 1. Many couples therapists will attempt to address the victim's behavioral responses to the abuse rather than the abuse itself. A couples therapist often has to remain neutral to see both sides and both perspectives in the therapy room in order to avoid assigning any blame. In keeping up with this model, they assign a form of assumed equality, where both partners share responsibility for the nature and quality of their relationship. However, an abusive relationship is simply not equal for both partners by any means. The abuser has far more control and far more power over their victim, having spent months, even years, coercing, belittling, and gaslighting the victim into believing that he or she is worthless, going crazy, and imagining things. They are indeed at fault for abusing, and that needs to be acknowledged, not sugar-coated or denied. The abuser has far more responsibility than the victim in creating chaos in the relationship, and is thus the one who should be held accountable for stopping their behavior. Seeing both perspectives only places the victim at a further disadvantage, as he or she feels even more invalidated, invisible, and forced to take responsibility for the abuser's toxic behavior. In the Clinical Handbook of Couple Therapy, clinicians Gurman, Lebo, and Snyder note, quote, "Such absolute neutrality may help to maintain a focus on presenting the problem and enhance treatment effectiveness. On the other hand, accepting information provided by the couple at face value risks ignoring potentially critical clinical information. For example, many couples present with quote-unquote communication problems, but experienced therapists know that such euphemisms can mask far more serious problems. If the therapist accepts the presenting problem at face value and makes no independent assessment, he or she might overlook serious but unvoiced issues such as substance abuse, chemical dependency, and or intimate partner violence. Shared responsibility in the couple's counseling session also causes the therapist to look at what the victim could be doing to quote-unquote provoke the abuser's behavior or better manage the abuser's actions. For example, the therapist may suggest that victims work on their quote-unquote jealousy issues when the narcissist is actually purposely triangulating, otherwise known as manufacturing love triangles, them, or deceiving them. They may hyper-focus on the way a victim behaved in reaction to a verbally abusive incident, rather than addressing the abuse itself. They may coach victims to try to better understand the narcissist's perspective, which is likely already the focal point of the relationship since it's centered around the abuser's needs, leaving the victim feeling even more voiceless than when they first entered therapy. Coaching someone who is already empathic to be even more empathic towards an abuser who uses that empathy against you does not work. It only makes the victim responsible for something he or she had nothing to do with. Abusers are abusive and will remain abusive regardless of what their victims do. And they will actually exploit their victims even more when they are shown incredible amounts of empathy. Couples therapists must acknowledge the fact that abusers rely on pity ploys to draw their victims in and keep them hooked on the abuse cycle. And they must recognize the signs of even more covert abusers and their manipulation tactics in order to provide victims with the help and resources they need to exit, not stay within the relationship. Number 2, manipulative abusers will often put on a charming facade for the therapist, fooling them into thinking that they are the true victims. Narcissists will use therapy as a site for further gaslighting their victims, if they even attend at all. Couples therapy is designed to help both victims sort out problems in their relationship and to improve communication patterns. This design can be helpful when both partners are empathic, both committed to improving, and both are open to feedback. However, when one person is highly narcissistic, unempathic, and is prone to narcissistic injury at any perceived slights or criticism, it is unrealistic and even potentially harmful to assume that abusive partners have the best interests of anyone but themselves in mind. The abuser is only committed to defending himself or herself. This means they will engage in the same tactics they do in the relationship in the therapy space to maintain the status quo of power and control, or they may even wear a mask to fool the therapist. It's not uncommon for abusive partners to blame shift, project, and minimize incidents of abuse in an effort to maintain their image as the innocent partner who is put upon by the complaints of the abused party. Although some couples therapists who are experienced in manipulation and abuse will recognize the signs of abuse quickly, not all are equipped to discern the true nature of a narcissistic personality. They can be very superficially charming and convincing. I have heard many stories of couples therapists being easily charmed and swayed by the narcissistic partner into believing that the abuser is actually the victim. I have even heard a few tales of couples therapists who engaged in an unethical affair with the narcissistic partner, their client's own spouse or partner. Of course, these cases probably involved a therapist who was already unethical and narcissistic themselves. But regardless, there are many out there who may still miss the signs and cause harm unintentionally. It's important that couples therapists be trained and alert to the fact that an abuser can be quite charismatic, charming, and convincing, that they can wear a mask. That is very compelling, but that does not mean the victim's experiences of the abuse are invalid. Keep in mind that even some of the most renowned psychopathy experts, like Dr. Robert Hare, admits to still being taken in and duped by these types. No one is immune. In fact, I would advise therapists to be on the lookout for types who seem overly charismatic, and yet who have partners who appear depleted, angry, anxious, and depressed. Those who say all the right things are often the ones who are capable of quite the horrendous actions behind closed doors. The victims, of course, may appear less charming and likable in the therapy space because their energy has just been drained by an abuser. After all, who do you think is more likely to be calm, happy, and upbeat in the therapy room? The victim who has already been terrorized relentlessly, subjected to hypercriticism, or the abuser who is benefiting from a perpetual power trip at home where they can continually provoke the victim? Number 3, Therapists who aren't aware of the manipulative tactics narcissists use or the complex dynamics of trauma bonding risk re-traumatizing survivors. All therapists should be well aware and knowledgeable in not only the manipulation tactics narcissistic and sociopathic individuals use to undermine their victims, but also the trauma bonding which can result from such abuse. The deep attachment and loyalty victims develop towards their abusers in order to subconsciously cope with and survive the abuse is known as the trauma bond. Therapists should understand the effects that tactics like love bombing, gaslighting, stonewalling, covert put-downs, isolation, and micromanaging have on victims over time. They should also be aware that victims who bring their abusers into the therapy space are often under the illusion that their abuser can change. They are holding on to a false hope that this is a quote-unquote communication problem which can be fixed. They are looking for a cure, a third party who can help them fix the narcissist. If a couples therapist recognizes that abuse is occurring, it is far better to take the victim aside and tell them that they should be in individual therapy to guarantee their own safety rather than to continue with couples counseling. As Albert Dyke also notes in his article about couples therapy and partner abuse, we might be tempted to believe that clients bear some responsibility for staying silent on the issue, whether out of fear or outright denial, but the obligation to assess rests firmly on our shoulders. For example, an abused partner may feel unsafe bringing up abuse in the presence of the other because of likely retaliation. Yet many therapists have a policy of never meeting separately with one member of a couple that they are treating jointly. The couples therapist should be aware that the victim may minimize the abuse, defend the abuser's actions, or find ways to rationalize staying in the relationship due to the trauma bond. The trauma bond does not mean that the victim isn't experiencing abuse, however, but that they are suffering from the traumatic aftermath and mental fog of what an abusive relationship creates. Number 4, there is a power imbalance in the relationship. So long as the abuser controls the victim outside of the therapy room, there is a threat of harm and retaliation for anything that is brought up in therapy sessions. Couples therapy is all about transparency, mutual empathy, and understanding, reciprocal understanding, in fact. It can be highly beneficial when both parties are fairly equal in the power that they share and they don't feel as afraid of retaliation when sharing their innermost feelings. In an abusive relationship, however, it's very possible that therapy sessions could actually escalate the abuse outside of the therapy room. Victims may be punished emotionally, verbally, or even physically for things that they disclose to the therapist. There is never any real freedom when you are in an abusive relationship. No matter how politely you address your issues with your abuser, you will inevitably be punished later on due to their narcissistic rage and entitlement. That is why it is so important that couples therapists exercise mindfulness when they see signs of escalation within the therapy room. There are issues that the abuser will often not want to acknowledge, and it will become clear in how agitated they become and how they attempt to shut down those conversations and blame shift. It's important that instead of trying to force the abuser to communicate better or trusting that he or she will, some abusers will pretend to be accommodating but will still abuse the victim behind closed doors at home, that the victim is taken aside in a confidential manner, that they know that they are not at fault for the abuse, that they don't have to continually try to improve themselves for someone who will never change their own communication patterns, and that they can do safety planning with the therapist if the therapist believes that there may be any kind of physical danger involved. Number 5, the further someone is on the narcissistic or psychopathy spectrum, the less likely they are to change. All therapy is founded on the idea of beneficial change and the potential for this type of change. even if it does not occur right away. Whether it's aiding a struggling relationship or helping an individual towards personal development, it is the progress of a client which attests to the strength of the therapy. Yet, couples therapy ultimately cannot work when there is a victim all too willing to change themselves to somehow stop the abuse, and an abuser who plans to never make any real progress. Therapists must be aware that there are individuals who are so far on the narcissistic spectrum that they are unlikely to change their hardwired patterns within their lifetime, let alone within an intimate relationship. This has nothing to do with the victim and everything to do with the abuser. Rather than placing any burden of the abuser's actions onto the victims, it's time that couples therapy is reformed to properly identify the red flags of an abusive relationship and to encourage victims of abuse, whether emotional or physical or both, to do individual therapy, which can help them leave an abusive relationship safely, or at the very least come to terms with the reality of the abuse and the manipulation they're experiencing. I'll talk to you guys soon, and until next time, take care.